Hello, everyone. This video is disorders of the shoulder, part 2. So these are deeper muscles of the shoulder. So we're going to talk about slightly different topics in this video. We're definitely going to mention the rotator cuff and some impingement syndromes that can occur with some of the rotator cuff tendons. This goes along with the Word document in your D2L, shoulder and arm disorders 2. All right, so we're going to start with shoulder tendonitis and shoulder impingement. Kind of the same thing, or one can cause the other. So with shoulder tendonitis, you have inflammation of the rotator cuff tendons. Okay, and itis is inflammation, if you recall. The symptoms include pain with movement. So any kind of movement involving the rotator cuff muscles is going to cause this discomfort. In tendonitis, the pain typically doesn't occur all the time. It's mostly just with movement. Now, if it's a severe tendonitis, yeah, it's going to hurt kind of all the time until that inflammation starts to subside a bit. But with more of a minor tendonitis, it will only hurt with movement, or it will start to hurt when you move and then continue to hurt slightly after. So reaching overhead or trying to reach behind the back is going to cause pain. You'll have that kind of dull ache at rest, but not that pain that you get with the movement. And then, of course, you're going to have some shoulder weakness during these movements because it's going to hurt to do it. The causes are mostly repetitive movements. Overuse of those muscles will cause the tendons to become inflamed. It could also be poor posture, so slouching all the time where the shoulders are constantly rolled forward. It could be sleeping with one arm under the head. Does anyone sleep like this, or sleep with your arm under your head instead of down by your side? That can cause inflammation in those tendons as well. Treatments for this, of course, are standard treatments for any inflammation. So ice, rest, sometimes compression, elevation, anti-inflammatories. That's going to be topical or oral analgesics. If it's really bad, the cortisone injections, because cortisone is an anti-inflammatory actually that your own body makes, and physical therapy if it gets really bad, which I have seen. I have a couple of clients recently who have undergone physical therapy for rotator cuff issues. Massage is completely indicated, absolutely, because if it's an overuse syndrome, then of course we can help by balancing out the musculature and relieving some of the adhesions that might be found within the tissue. Muscles may be hypertonic. Hypertonic means, of course, having more tone. This would be tight, right? They may be tight from guarding from the pain. Okay. The only thing that we need to be careful of course, is that this is an itis. So if there is active signs of inflammation, if there's swelling and tenderness and heat coming from anywhere in that area, then we need to work around that. We cannot work directly over that area. We don't work directly on inflammation. For the umpteenth time, we do not. Okay. Number 2 is shoulder impingement. This is similar to shoulder tendonitis. However, we're really talking about the supraspinatus tendon getting jammed up underneath the acromion process when mostly abducting the shoulder, flexing it as well. So what happens here is that the supraspinatus tendon is rubbing against the acromion process. And the tendon itself might start to fray or might start to become inflamed as it constantly shears underneath that piece of bone. Over time, this can cause tendinitis. So it becomes supraspinatus tendinitis. Now, that's what this little asterisk here may lead to tendinitis. The symptoms are pain with movement, of course. And again, that's going to be the movement of supraspinatus. So flexion and abduction, specifically around 90 degrees. So right about here is when you really start to feel it. So what can cause this? Something called poor glenohumeral rhythm, and that actually is referring to how the glenoid fossa receives the head of the humerus. Normally, of course, it's supposed to sit in there all nice and even. In poor glenohumeral rhythm, it doesn't. It may sit slightly inferior or slightly anterior, and whenever you move the humerus, instead of sitting inside the fossa like it should, since it's slightly out of place, it rubs on all the structures in that area. So that causes the tendon to not be in the right place, and then it causes it to be smashed up underneath the acromion process. Poor posture, traumatic injury, like fall or something like that, that can all cause shoulder impingement. I have to say though, one of the #1 causes of supraspinatus tendinitis is sleeping with your arm underneath your head. I see this so many times in supraspinatus tendinitis. So it's shoulder impingement can lead to tendinitis, can lead, these are kind of the same thing, but not exactly. The tendinitis is the actual inflammation of the tendon. The impingement is when the supraspinatus tendon just gets pushed up underneath the acromion process there. Massage is absolutely indicated because you're going to want to treat the imbalance. All right, #3 is rotator cuff repair. Obviously, this is going to be a surgical repair. If a rotator cuff tendon is torn or the muscle itself is torn, it might require surgery. The surgery happens when you have a full thickness tear or a almost full thickness tear. In other words, like if it's just hanging on by a thread, they'll want to surgically repair it. Otherwise, they don't. Muscle tears heal on their own, and they do heal rather quickly because muscle is highly vascular. In other words, there's a great blood supply to muscle. So that helps it heal fast. Tendons, not so much. They take a lot longer to heal because they don't have the blood supply that tendon or that muscle does. So it really depends on what structure was injured, whether it was the muscle itself or whether it was the tendon, and whether it was repaired surgically or left to heal on its own. Either way, remember your post-surgical precautions. You don't work on anything immediately after surgery. You need to wait at least 6 to 8 weeks. Probably after physical therapy is when they are going to come to see you. But massage can absolutely help with the muscle imbalance that was caused by the injury, because if something is injured on this side, then the client is going to start overusing the opposite side to spare the injured side, right? So that's the kind of thing that we're going to be looking for. We're not necessarily working on the injury itself. We're going to be working on the muscle imbalance that was a result of the injury. We may, with more training, work on the scar tissue if there was surgical repair. And we might help increase range of motion and flexibility on the affected side after it has fully healed. Also, I should probably star this. Be aware that lying flat on the table might not be okay for your rotator cuff client. They might not be able to lay supine, they might not be able to lay prone completely. So you might have to put a rolled up towel either underneath the anterior bit of the shoulder if they're laying prone, or maybe a rolled up towel or something soft underneath the shoulder on the opposite side if they're laying supine. You just work with them, make sure that they are comfortable. All right, and last but not least, we have thoracic outlet syndrome. Thoracic outlet syndrome is actually an umbrella term because it's a neurovascular impingement anywhere along the thoracic outlet. And the thoracic outlet starts in the neck, as I mentioned, when we were talking about the brachial plexus, that's actually where all of this begins. Then it goes underneath the clavicle, then underneath pec minor, then over to coracobrachialis, and then it branches off down the arm. So anywhere in where I just described, the brachial plexus can be compressed or pinched. And if that happens, then you get symptoms of pain, numbness, and tingling down the arm, okay? So causes vary. Of course, causes vary because anywhere along there you can have a muscle or muscles compressing that neurovascular bundle, or you can have misaligned ribs, like a rib out of place, which hurts in and of itself. You can have muscular spasms of the pec minor or scalenes, which we'll get to scalenes in another unit. Heavy objects on one shoulder, like actually having a heavy book bag on one shoulder all the time, can cause thoracic outlet syndrome and put pressure on that neurovascular bundle. Or even being very large chested and wearing bras that cut into your shoulder can cause thoracic outlet syndrome. It is often mistaken for carpal tunnel syndrome because, as I mentioned in a previous video, if you have numbness and tingling down to the hand, the immediate thought is, oh no, that's carpal tunnel, because a lot of people are familiar with carpal tunnel symptoms, pain, numbness, and tingling in the hands. Well, that doesn't necessarily mean that it is true carpal tunnel syndrome. It could be coming from way up in the neck or in the shoulder. Our job as a massage therapist is to assess the client to find out really where this numbness and tingling is coming from. We start at the neck and we work our way down. Okay, that's what a prudent therapist would do rather than saying, oh, you have numbness and tingling in your hand. Well, must be carpal tunnel, let's work there. No, we're going to start at the neck and work our way down, okay? Now, in your visible body, you do have rotator cuff visuals. So I would check that out as we go through, rotator cuff repair and issues like that. Also in the discussion post, pardon me, I'll stop the share for a second. The discussion post is really all about rotator cuff. A lot of people have questions about rotator cuff injuries and issues that maybe someone they know or maybe yourself has had in the past. So please feel free to post there any questions or comments or anecdotes or stories or anything like that about the rotator cuff. And of course, I will see you soon.